Hi everyone, welcome back to our channel NursingVerseK. Today we will discuss about the most important MCQ for pediatric nursing. Before starting the MCQ sessions, we will give the informations about the test series. In the test series, you will get the unlimited MCQ practice, only 2,999. Validity you will get for the lifetime free. Topic wise MCQ, test paper, also daily MCQ practice, full structure wise MCQ for the NORCET and other nursing exam. And if you want to take the test series, you can contact this number, only message this number, you will get all the information. Let's start the MCQ sessions. First question: a nurse is assessing a 12 months old infant. By the end of the first year of the life, the infant's birth weight should have option A doubled, option B triple, option C quadruple, option D remained the same. The answer will be option B triple. Normal birth weight is 2.5 to 3.5 kg. Double in 5 to 6 months. Triple by 12 months, and quadruple by the quadruple in the 2 years. So the answer, they ask for the 12 months. In the 12 months the birth will be triple. So the answer is option B. Next, which of the following is the best approach for performing a physical examination on a toddler? Option A head to toe approach, option B distal to proximal approach, option C least to most intrusive approach, option D proximal to distal approach. The answer is option C, least to most intrusive approach, because for toddlers the examination should proceed from least to most intrusive. This reduces the anxiety. This what will happen? This reduce the anxiety and increase the cooperation. Head to toe is a standard for adults but not the ideal for the toddler. So the answer will be option C. Next, the median age for a child to begin walking independently is option A 6 months, option B 9 months, option C 12 months, option D 18 months. The answer is option C, 12 months the child can begin walking independently. And sitting without support is sitting with the 6 to 7 months, sitting without support. And 9 months, 8 to 9 months the baby will crawling, 8 to 9 months. And 12 months walking independently, they asked for the walking independently. So the answer will be option C. And 18 months the baby will running. Next, the earliest sign of puberty in females is option A puberty, pubic hair, option B growth spurt, option C thelarchy, breast development, option D menarche, first menstruation. The answer is option C, thelarchy, breast development. Breast budding or the breast development is the earliest sign puberty in the females. Typically occurs between 8 to 13 years of the age. Puberty follows, then growth spurt, then menarche is late event. Menarche is the late event, typically 2 to 2.5 years after thalarchy. So the answer will be option C. It is the first earliest sign and the last is the menarche. Next, within 3 minutes after birth, the normal heart rate of a term neonate may be range between option A 80 to 100 beats per minute, option B 100 to 130 beats per minute, option C 120 to 160 beats per minute, option D 160 to 180 beats per minute. The answer will be option C 120 to 160 beats per minute, because normal neonatal heart rate is normal is 120 to 160 beats per minute. When it will goes up to 160, it called as tachycardia. When it's less than 120, it's bradycardia. 100 it's called as bradycardia. So within 3 minutes the heart rate stabilizes after the initial transition. This is frequently tested in the neonatal assessment questions. So the answer is option C. Next, the expected respiratory rate of a neonate within 3 minutes of the birth may be high as option A 30 breaths per minute, option B 60 breaths per minute, option C 80 breaths per minute, option D 100 breaths per minute. The answer is option C 80 breaths per minute. Immediate after birth, the respiratory rate can be up to 80 breaths per minute, stabilizing to 30 to 60 beats per minute within the first hour. Within the first hour. Tachypnea in newborn is more than 60 after the transitional period. So the answer will be option C 8 breaths per minute. Next, soon after delivery, the nurse begins the initial newborn assessment by option A palpating lung sound, option B measuring head and chest circumference, option C inspecting posture, color and respiratory effort, option D checking for identify birth marks. The answer will be option C inspecting posture, color and the respiratory effort, because the initial assessment means immediate evaluation. It begins quick global assessment of posture, muscle tone, color and respiratory effort, including the APGAR score in 1 and 5 minutes. Detailed measurements and full physical examination follow after the stabilization. When the baby will stabilize, then we will do the physical exam. So the answer is option C. Next, a term neonate has thick white cheesy coating on the skin. This finding is correctly described as option A lango, option B milia, option C nevus flammeus, option D varnish sciosa. The answer is option D varnish sciosa, because varnish sciosa is a thick, its feature is thick white cheesy substance covering the skin of term infants, providing protection in utero and moisturizing after the birth. Lango is fine hair. Milia is teeny white sebaceous, teeny white sebaceous cyst on the face, and nevus flammeus is a pot wine stain. So the answer will be option D. Next, which nursing intervention has the highest priority for a neonate immediately after birth? Option A, obtain the stool sample. Option B, administer vitamin K injection. Option C, give the initial bath. Option D, cover the neonate's head with the cap. The answer will be option B, administers vitamin K injection, because vitamin K is given IM within 1 to 2 hours of birth to prevent the hemorrhagic disease, of newborn. While covering the head prevents heat loss, vitamin K is a high priority safety intervention. Bathing is delayed to maintain the temperature and the blood glucose level. So the answer will be option B. Next, a woman delivers a neonate 42 weeks of gestation. Which physical finding is expected on examination? Option A, absence of sole creases. Option B, abundant lango. Option C, lethargy, cracked, wrinkled skin. Option D, absent breast buds. The answer will be option C, lethargy, cracked, wrinkled skin, because postpartum infants more than 42 weeks exhibits the post-maturity syndrome. Post-maturity syndrome is like a dry, peeling, cracked, lethargy skin, meconium staining, long nails, and decrease the subcutaneous face. So the answer will be option C. Next, when providing care for a newborn with suspected sepsis, the nurse should follow which precautions? Option A, standard precaution only. Option B, airborne precautions. Option C, droplet precaution. Option D, contact precaution. The answer is option A, standard precaution, because for a newborn with suspected sepsis without identified organism, standard precautions are sufficient. However, if specific pathogens like RSV requiring contact precaution, influenza requiring droplet, and are identified, additional precautions are added. So the answer will be option A. Thank you everyone. Please like, share and subscribe our channel. Or if you want any specific topic or specific MCQ for this topic, in another topic, please message, comment below. And if you want to join our test series, you can contact this number. Anytime you can message this number in WhatsApp. You will get lifetime free test series, daily updated, daily MCQ practice, and the test paper and topic wise MCQ. Thank you everyone. Please like, share and subscribe.